Hello and welcome to Breaking Barriers in Collaborative Care. We aim to bridge the gap between healthcare professionals and patients, providing valuable insights, discussing common challenges, and exploring innovative solutions. I don't think excited is a big enough word for the emotions I'm feeling today. I'm being joined by Minister Tibollo, who is the Minister of Mental Health and Addictions here in Ontario. Welcome so much, Minister. Thank you for joining us today.
It's my pleasure to be here. Thank you for having me.
This is a big day, and as we know, May 6th to the 12th is Mental Health Week. So this is fantastic to have you joining us to be able to talk a little bit about mental health and addictions and how it relates to our province, but even beyond that. So before we get into kind of those hard-hitting questions, I'm hoping you could just explain a little bit about what the role is at the provincial level of a minister, and then we can get more into your specific role.
Okay, well, the government basically operates with a number of MPPs that sit on the side of the House to form government, and in our case, we have a majority. And then from the group that get elected, the Premier selects people that he believes to be the best suited to do a particular function. So in my case, he gave me the portfolio of mental health and addictions because of my background in mental health and working with young people with addictions. And my job really is to coordinate policy and implement a strategy for the province when it comes to people's mental health and any potential addiction issues they have. It's an interesting portfolio because it really ties into another 16 portfolios. So decisions that are made have to really be based on a government wide approach. It can't just be in a silo. But in the past it was. And so everyone would do their own thing within their silo and never really have a policy, a plan, a strategy. So one of the first things I did when I became minister was write the Roadmap to Wellness, which is our plan to develop a strategy, a continuum of care, a system of mental health and addictions for the province. And so I did that in 2019. Of course, March of 2020, when we announced it, I was at Ontario Shores, and we were talking about, this virus that was floating around that nobody really knew what it was. And it kind of took all the thunder from the Roadmap to Wellness. And of course, 1 week later, they declared the pandemic, the worldwide pandemic with COVID-19. So we've been working with the Roadmap to Wellness now over 3 years. Unfortunately, or fortunately, because one of the things that we did learn from COVID was that we could adapt to using, things like the internet to provide supports and services to individuals as well. So it forced us to adapt and really advance a lot of new ways of delivering services to people that have mental health and addictions issues.
Absolutely. And I know a part of the Roadmap to Wellness, one of the 4 pillars of focus was access to resources. And I know that we've talked with some of our other guests that access to the resources is a big problem amongst certain populations, just as a whole in healthcare, let alone in mental health and addictions. And certain populations, we know our Indigenous populations may have harder time accessing resources, or those in remote areas like the North. So how has this Roadmap to Wellness kind of navigated that and increased our access?
So one of the things that I learned very early on was that you have to deliver the services in a culturally appropriate way, but you also needed to understand the needs of the individual at the different stages of the person's life. So one of the things we did was break down the developmental cycle of a human being from, 0 to, originally it was 0 to 12, but now with infant mental health being prevalent as well, something that we need to understand better, especially after the COVID-19. Mm-hmm. But 0 to 6, infant, 6 to 12, child, 12 to 24, youth, 24 to 45, 45 to 65, and 65 and over. And that became the first kind of like, what do we need to do to make sure that the person is getting age-appropriate support and services? Then the next piece that came in was to develop a step care model, because we knew that there's acute cases, there's moderate cases, there's mild cases. We needed to understand the full continuum need of individuals and the type of services. So this started to bring us to a client-centered approach so that we understood the needs, not one size fits all. And then the last piece, which is to me the most significant, is culturally safe and appropriate services. You can't have a guy like me. You can, but it takes a long time to build a therapeutic alliance. But it's hard for someone like me to go into an Indigenous community or a Black community or many other communities and try to deliver supports and services because I'm not from that culture. And you might think, well, it doesn't matter because you're dealing with a common problem. The thing is that there are a lot of different communities have intergenerational trauma. And to understand that intergenerational trauma, you really needed to live it or to live in a home where it was prevalent. And so my work in this area is to try to bring as many people from these different communities into the area of practice so that we have trained people who can provide these supports and services to individuals, and meet them where they are. So the roadmap to wellness, and again, it's funded by $525 million, $3.8 billion over 10 years to invest in creating these types of supports and services. And again, delivering those supports and services where the individual lives so that they're not having to travel thousands of kilometers to get help and then have that help really not be effective because they're not in their communities. So my work really as the Minister for Mental Health and Addictions is to look at that lifespan. And again, just in explaining that, there's Ministers of Seniors and Accessibility for over 65. There's a Minister of Education, a Minister of Colleges and University. Excuse me. There's a Minister of Housing. There's a minister. Now, all these ministries really need to collaborate if you're going to build a continuum of care and address the needs of the individual through that throughout that whole timeline or lifeline of the individual from birth till death.
And what you're saying, I think, about this continuum care is something that a lot of our guests have been talking about, that things have been done previously in a silo in healthcare, where that's not something that is really feasible moving forward. That's collaboration amongst healthcare providers, amongst politicians, amongst individuals is really necessary to ensure that this holistic care, especially now talking something like mental health, where it affects really every part of an individual's life, and the care that they receive really has to exemplify that. So yeah. I know that with this budget moving forward, the continuum of care is something really, really important. And I'd like to talk a little bit about this no one is left behind and what that looks like and the plan to really roll that out.
Yeah, so for me, the most important piece is to make sure that those supports and services are there for everyone, where and when they need them. And the issue, I think, I believe, has been that, as a government, and really most governments in the Western world, we've built a reactionary system. Our healthcare system is based on the hospital being the center of the universe. And you go to the hospital when you're sick. And as a result of that, a lot of work that should have been done in prevention is never really done, or it's never given the same level of seriousness as the work in the hospitals. So one of the things that I've done, and I've worked really hard to do, is to build a community-based system to put as many of the resources into the community, into organizations that have mushroomed up all around the province to provide supports and services where the hospital wasn't able to, or where they couldn't find services that were funded by the government. I can give you 100 examples of, a mom who had a child that was autistic, that needed support. The supports weren't there. They set up an organization. A mom who had a son who had an addiction, they couldn't find any help anywhere. They set up their organization, and all of a sudden people start gravitating towards these not-for-profits, and they started doing a lot of the lifting, simply because there was a need and the hospital wasn't the place to go to get those types of supports. So I'm trying to reinvent that and basically say the hospital is where you go for acute care. But we need to do a couple of things. One, build a continuum of care outside of the hospital to deal with these issues. But also we need to invest heavily in prevention and early interventions. And what does that look like? It looks like the youth wellness hubs that we're opening around the province. It looks like, introducing mental health literacy in the school in 3 grades. It looks like working with parents early on to teach them about the importance of everything from nutrition to socialization, behavior, cognitions, how the kids are process information. We need to be more engaged if we're going to make a difference in the world and really take the pressures off of our hospitals and put them where they should be in the community, those supports.
That's fantastic. It's great to hear that you have this approach of doing something, not waiting, and that reaction that has previously been how we do things. And I hear you say that, a lot of these areas that you're now leaning into were areas that self-advocacy really kind of was the forefront. And a lot of those who use mental health and addiction services, the research says anywhere between 25 to 50% report having had a traumatic brain injury. And we know that's a population that can't always self-advocate. So is this a population that's also being considered and something that we can do in the province for mental health and addiction services for these folks?
Yeah, see, that's part of building a system. Building a system, you're not going to get it right the first time across the board. Like, it's impossible. And I work really hard. I mean, I interviewed people from every walk of life, every culture, LGBTQ2, Black, Indigenous. I mean, I really crisscrossed the province, and every opportunity I had to meet another person or another group. And every time I would meet with them, I'd always say the same thing to them. Tell me where the gaps are in the system. Tell me where you see I can improve and build connection. So the first thing that we did was try to organize these continuums of care. And we're still building them. I mean, it takes time to implement something, especially when you have a province the size of Ontario. But the intention was to build these continuums of care and then look to see where gaps existed. So we know, for instance, that young people or individuals with neurodevelopmental challenges, they have needs, mental health needs, but they were being looked after by MCCSS, a different ministry. And that ministry wasn't really providing mental health care supports. So we moved them into the Ministry of Health so that we could provide those. But, people with brain injuries, people with, these are where the gaps need to be addressed still. And we're working towards that. And these are the investments that we're making with that money. That's why, we put a significant amount of money, probably the biggest investment in the history of Ontario for sure, maybe Canada, in terms of what we were going to do to build this continuum of care. So I'm anxious to always meet people that can provide me input as to where the gaps continue to exist, so I can fine tune what we're doing and really build a system that works.
And it's really refreshing to hear you, a politician in such a high level, say, well, no, there are still gaps and we have work to do, and I'm willing to listen and do this, instead of trying to skirt around or say like things are great. It's really great to hear that, we still have work to do, and to recognize that and be willing to do the work.
Yeah. Well, I'm fortunate because I come from the world of mental health and addictions. I was a lawyer, but I also spent 10 years working with people with addictions and concurrent disorders. So I have a a little bit more knowledge maybe than the average minister would on this specific topic. Although there are other ministers that have, huge experience in municipal and other areas. But in mental health and addictions, I'm laser focused on the issues that relate to building that system of care, simply because I know the system was broken or really didn't exist before coming to government. And, the mandate is not a long time. We're only here for cycles of 4 years. So a lot of work to do in that short time. So you got to get at it right away, and you got to stay on top of it and start bringing about, the changes so that you can start to see the results. And then, like I said, tweak it so that you fix wherever those gaps continue to exist.
Oh, absolutely. And I'd love to know that so far in your term, what do you think the biggest difficulty has been for yourself personally?
Well, I'm frustrated. I'll be honest with you. I came from a world where we used to say all the time, you eat what you kill. You eat what you kill basically means that as a lawyer, you do some work, you get paid, and you get eat. In government, it doesn't work like that. So it's a little bit strange. Here, you get paid regardless of, how hard you work. And it's frustrating for someone like me that comes from a capitalist business, right? A business that, you've got to work hard to make the money and to earn a living. It's difficult for me to be here and sort of like, well, it's going to take you 2 weeks to get this answer. It's like 2 weeks. I want it in the next 10 minutes. And, or, it's going to take us 2 years to put this together the study that you need. Like 2 years, that's half my mandate.
Yeah.
I find that very frustrating because we're much more agile in business than government is. And I respect the fact that, we're spending taxpayer dollars, so we've got to be careful. We got to do it right. There's procedures, but man, is it frustrating.
And the other side of that same coin is you're using taxpayer dollars, so maybe move things along a little quicker.
You think, right? I mean, that's my my way of operating is that, like, let's get this done because I've got so many issues to deal with. But it seems like the issues pile on, and it just takes a long time to get anything done. But that's part of government, I guess, and I'm not going to change it in the 4 years that I'm here. It's been that way for a long time, and there's policies and procedures that have to be followed.
Absolutely. Hopefully one day that'll become a little more streamlined.
Yeah.
And what would you say your biggest win has been so far?
Well, there's been a lot of really interesting things that I've done. To me, one of the biggest, because I know it's going to have a profound effect on generations of first responders, was the work that we're doing right now to build a center of excellence to look after first responders with PTSD.
But
that to me is a big deal. The creation of 400 treatment beds, 7,000 treatment spots for people with addictions. And I'm hoping that I'm going to be able to increase that by at least another 400 before the end of this term. The youth wellness hubs, to me, have been phenomenal because we've had over 160,000 kids or visits through the 17. Now we have 22 of them, and I'm opening another 5. But that's 43,000 unique individuals that used it 160,000 times. I just think to myself, where would these kids go if they didn't have a youth wellness hub? So that's a real to me a big achievement and something that I see as a very positive. So I've had a few things that that would they have happened if I wasn't here? Maybe not the treatment recovery fund, not the PTSD center, maybe the youth wellness hubs. I don't know if they would have expanded as quickly because I saw it right away that these were phenomenal investments for us. They're not expensive, but they have a huge impact on our children and youth. And it'll pay back in dividends later on because every time we build resiliency in a youth, that's one less individual that's going to fall prey to a mental health or an addiction issue as an adult. So, lot to be said for that.
That's incredible. building up our youth is really the most important thing as a whole that we could be doing. So finding ways to ensure that they don't fall through cracks or create further issues for themselves, that they become susceptible to other mental health or other issues is incredible. And then I was just wondering, for all the folks listening who are thinking, there's, something I want to say on this topic, I want to talk to Minister Tibollo, how would they reach out to you?
I'm available. If they wanted to speak to me, they can reach out to me through probably the easiest is my constituency office. And I don't have the phone number with me right now. I don't recall it.
That's okay. We'll link it. It'll be either across the screen or below in the information for everyone.
Yeah, so if they want to reach out to me and speak to me, I'm more than happy to do that. My email, you can put that up as well if they have any questions or concerns. I get a lot of calls, a lot of issues sort of end up on my desk relating to suicide ideation, eating disorders, addictions. I get a lot of emails about that. I get a lot of emails about families with a loved one who's refusing treatment and wanting to get treatment for that loved one, and how do I go about doing it? So anybody that's listening that wants some help or needs an ear, I'm always available. To me, it's important to understand where the shortcomings in the system are, the gaps, so that I can address them. Because again, if we don't address the gaps, I'm at Queen's Park today, and I'm looking at Queen's Park right now. There's a bubble down here, right? Like, I don't know what's happening in all the communities around the province. I travel a lot to try to get a feel for what the needs are, but every community is different. Every individual is different. And so if I can understand the needs, I can address the issue more specifically for that individual and that particular community. So I'm all ears and always available.
Amazing. And you have a hard job to do. I can't say I envy you in the role that you have in such a big job across, a large province with, like you said, a very varied population, varied culturally, experientially, educationally. There's a lot happening here. And so there's a lot you have to cover. And mental health and addiction is a really big topic that covers, mental health is a very wide spectrum.
Yeah. And it affects every piece of our lives, right? I mean, that's the thing that I keep on telling. We'll have conversations sometimes with the Premier, and he's talking about how important the economy is to grow. And it is, because all these social services are funded by the money that's generated in taxes from economic prosperity of the province. So he's right. The economy has to keep growing. We need to, get people to jobs. We have to keep. But I always remind him that productivity is important and people's well-being is important, because again, without mental health, you won't have health. Without health, you can never have a healthy economy. And, our statistics are staggering, right? 200,000 people. Imagine that 4 Scotiabank stadiums, 4 full of adults don't go to work every week. 200,000 people. Like I just the magnitude of that and the implications of that to the workforce and to productivity is phenomenal. And then, 900 construction workers died of overdoses to fentanyl. Like, a lot of people don't realize that fentanyl and a lot of these drugs isn't just a homeless issue. It affects families of people that have mortgages, that have homes, that have jobs, and we need to do more. We, as a government, we need to do more to educate people and to find ways to deal with some of these complex issues so that an individual doesn't feel he or she has to self-medicate with a substance.
And that's great to hear. I was going to say, if there's something you could leave our listeners with about mental health and addiction, I think you just really hit the nail on the head right there, that this is something that affects folks across the age groups, across economic status. So anyone can be susceptible to a mental health or addiction issue, depending on where they are at in life. And it really doesn't it's not just the homeless folks. That I know people go by and see that and really blame addiction in that population, and that's not the reality. When we look across, we see it in the affluent, we see it in the working class, and we see it in those living in poverty as well.
Yeah, it's everywhere. And that's why it's so important to have a plan, a strategy, why the roadmap to wellness is so important, because it affects all communities, even different cultures. It affects them differently because some cultures are collectivist in nature. And so it's a family thing. And you have someone with an addiction or a mental health issue, we don't talk about it. You tell them to suck it up. You tell them, but that is counterproductive to the individual's overall health. And so it's important that, that we build a system that's able to assist and pivot to the needs of the specific individual. And that's why a holistic, culturally safe, client-centered system of care is what we need to do. And that's where we see the compassion, is when you have that type of a system. So, for the people listening, like I said, do not feel like there's something wrong if you're not, it's okay to not be okay. Ask for help. Talk to people around you. There are resources, if you don't want to talk to someone, pick up a book. There's a lot of good books. There's a lot of good audiobooks as well, exercises that you can do. A lot of people can look after themselves without needing to see a doctor or a psychiatrist, a psychologist. But what I always say is, if you need to get help, get the help. There's nothing wrong with it. You would go to the doctor if you cut your arm and needed stitches. Why wouldn't you go, something's not working right in your mind? Your mind is probably more important than getting the stitches. I don't know if that's the case, but it's extremely important to look after your mind, because at the end of the day, you've got one, and it really focuses and makes everything else happen. And then, like I said before, no mental health, no health, no health, no health in the economy. So we've got to look after ourselves, and we have to look after each other.
Absolutely. And I'm hoping that by having conversations like these, by talking about resources that are available, that plans for the future, that these are things that matter, that'll help destigmatize these issues, and that folks will be more willing to talk to one another, to their friends, to their family, to a stranger, to someone, to find a book, to find a resource, to maybe go to a youth hub or get their kids set up in a program like that to help really, like I said, take away the stigma of mental health problems, because that's, I think, a big piece of getting help, is just that, I don't want people to think, this or that about me. So hopefully, like I said, conversations like these are starting for some individuals to realize that they can talk about how they're feeling.
Yeah, for sure.
So thank you again so much, Minister Tibollo, for being with us, for talking about your role, mental health and addictions, some of the things that have already happened and things that are going to happen as well. And if you are listening and are thinking, hey, there's a gap that I've recognized, reach out and let the minister know, so that hopefully more work can be done in that area. So again, thank you so much for being here. We appreciate it. And join us next time as we continue to navigate the complex world of healthcare, where transparency and honesty are at the forefront here on Breaking Barriers in Collaborative Care.